In a historic takedown, authorities charged 324 defendants across the nation, exposing over $14.6 billion in healthcare fraud schemes. Uncovering intricate webs of deception, investigators reported seizing $245 million in cash and valuable assets. Distinguishing between intended and actual losses, they revealed how data analytics thwarted exorbitant claims. Notably, Operation Gold Rush highlighted the staggering impact on patient data, and billions in potential losses thwarted, $14.6 billion in alleged fraud. 324 people charged. Cash, cars, crypto seized. Not a Hollywood sting. A real, nationwide takedown. Tonight we follow the money. How the schemes worked, what investigators saw, and what it means for patients and taxpayers. All defendants are presumed innocent until proven guilty. DOJ's 2025 takedown 14us. 6B healthcare fraud exposed. 1. The numbers behind largest ever. In June 2025, federal and state teams announced the largest healthcare fraud takedown in U.S. history. 324 defendants charged across 50 federal districts and 12 state attorneys general's offices. Officials say the schemes represented over $14.6 billion in intended losses, spanning telehealth, durable medical equipment, genetic testing, opioids, and more. Agents reported seizing over $245 million in cash and assets. The total actual losses, money that actually left public programs, are currently estimated around $2.9 billion, a fraction of what conspirators tried to extract. We'll explain why that gap matters and how analytics stopped a lot of these claims in their tracks. 2. Intended versus actual loss. Intended loss is the dollar amount conspirators attempted to bill or steal. Actual loss is what programs like Medicare and Medicaid actually paid before the claims were blocked, clawed back, or denied. The gap tells a story. Real-time edits, audits, and data flags prevented much of the money from ever getting out the door. It also shapes sentencing and restitution later. 3. How the rings worked. Investigators describe multiple playbooks: telemedicine plus lead gen, free consults funnel seniors to scripted diagnoses, then to high-dollar tests or equipment they often didn't need. Genetic testing. No-cost DNA kit pitches that convert into mass billing for expensive panels. Durable medical equipment, DME. Shell companies push orthotics, catheters, braces, sometimes never ordered by a doctor, never delivered, or wildly overutilized. Drug diversion, fake scripts, pill mills, and illegal distribution of controlled substances. Data teams linked billing patterns, provider networks, and identity overlaps across states. When those patterns spike, flags go up, then search warrants, seizures, arrests. 4. Operation Gold Rush. Inside the takedown, one case stands out: Operation Gold Rush at $10.6 billion DME scheme that investigators say used stolen American identities and foreign straw owners to quietly acquire Medicare-enrolled medical supply companies, then mass bill for items like urinary catheters. Court filings and reporting say the ring impacted over 1 million Americans' personal data. Here's the twist. Investigators say they intercepted over 99% of payments before Medicare money went out, and still seized millions in proceeds. But supplemental insurers, who often auto-pay co-insurance, were hit for roughly $1 billion. That's why the data fusion approach is growing. Multi-agency analytics, fast freezes, faster seizures. 5. The new playbook, data plus speed. This takedown wasn't just big, it was data-driven. Officials highlighted a healthcare fraud data fusion center that blends claims analytics, identity signals, and law enforcement intel to cut off flows of cash in real time. Think of it as a command room that translates messy billing data into actionable leads. That's why you see huge intended dollar totals and still lower actual payouts. It's a sign the filters are getting faster than the fraud. 6. What was seized and why it matters. Authorities reported seizing more than $245 million, cash, luxury cars, real estate, and cryptocurrency. Seizure is not conviction. It's a way to preserve assets before they vanish, potentially returning money to victims or the Treasury later. It also signals where conspirators hid proceeds and how quickly the government can freeze them. 7. The human cost. Behind the numbers are patients, confused by bills spammed with free tests or sent devices they never ordered. Doctors and pharmacies find their identities misused. Even when governments block payments, time and trust are lost. This is why the takedown matters. It's not just protecting budgets, it's protecting people.